Welcome to Scrambled, your space for fertility, owning your 30s, and the scramble that makes it all worth it.
On today's episode, we are joined by an amazing guest who's known as the Egg Whisperer. She runs her own fertility clinic in San Francisco's Bay Area and is no stranger to the microphone, hosting her own YouTube show and a podcast to educate men and women about their fertility. She graduated from UCLA's School of Medicine, completed her OBGYN residency at Harvard Medical School, and has a fellowship in reproductive endocrinology and infertility, plus a master's in public health from the University of Michigan. We are so lucky to be joined by the incredible Dr. Aimee to educate us on fertility and explain fertility testing, including her very own TUSHY method. Dr. Aimee, welcome to Scrambled.
Aw, thank you so much for having me. Love the name of your show because I call myself a momlet maker, and scrambled is the way I like to make my eggs. Yeah, I think of when you go up to the embryologist and you do the name check, I always feel like I'm going up to the omelet bar and just telling them what I want. That's how I treat every single one of my egg retrievals.
I like that analogy.
Love that.
That's really fun. Yeah, we obviously played on a similar thing with our name.
In this episode, we kind of just want to take everything back to basics. Fertility 101 for people who have never heard of it, maybe have heard a little bit, want to learn more, just to educate everyone who doesn't have the fertility knowledge and fertility background, including myself before I went through my egg retrievals. So, just to start, if you can break down what really is fertility and what does it mean?
Yeah, so fertility is one of my favorite F words. It's basically our body's ability to conceive and carry a healthy pregnancy. It's about how all the parts of the reproductive system work together, your hormones, egg quality, sperm health, and the uterus to make a pregnancy possible. I think about fertility as something that we should be proactive about, not reactive. And you don't have to wait until there's a problem. Ideally, we should be learning about our fertility in our 20s, not necessarily because we need to act, but because knowledge is power. I always tell my patients, test, don't guess. And from a medical standpoint, we usually start investigating after 6 months of trying if you're 35 years of age or older, 12 months if you're under 35, or right away if you just feel like something is off, like if your cycles are irregular, or if you know you have known conditions like endometriosis or PCOS, or if let's say your mom had to do IVF to have you, or if you just want to plan ahead for the future. I mean, I think everyone, but I'm biased, should see a fertility doctor before they try to conceive just to get some basic tests done. And I'd love to talk to you about those, but that's just my bias. But you don't have to, but I think it's a good idea.
When you say that, would you say people generally see you within that age bracket, or is there a big variation of the ages of people that come to see fertility doctors?
Oh, yeah. I mean, I have women in their early 20s that are just curious about their fertility and just want to get checked and see if egg freezing is for them. I have patients who just got engaged and they just want to check things out because they know when they want to get married and they want to be proactive and they want to wait a certain amount of time as a married couple before they have their first baby. So they come in to do some fertility screening tests to make sure that their timeline is not going to set themselves back.
So what sort of tests should people seek, or how do they go about seeking different kinds of testing for their fertility if they are becoming curious?
Yeah, so fertility screening should be really easy and straightforward. It feels overwhelming and complicated because we use so many different acronyms in fertility medicines. I'll share some of the most basic tests that we do, and that's basically everything that's in the TUSHY method, and each letter stands for the test that you should do to understand your fertility health. So the T stands for fallopian tubes. So the tubes are the embryo transport systems. That's where an egg and sperm actually meet. So if someone's fallopian tubes are blocked, a natural pregnancy is not possible, and that person would need to do IVF to conceive, and that's what IVF was invented for. The uterus is where the baby grows. So if there's a big fibroid smack dab in the uterus, or a uterine anomaly like a septum, or a bicornuate uterus, you can't just tell by looking at someone or talking to them about their periods. You would have to do a pelvic ultrasound to assess the uterine health. Then we have sperm. So we know that sperm is 50% of every embryo. So I've seen so many stories, and I'm sure you've heard them too, of women who've been put on fertility pills for a year and no one checked the sperm. Or one of my favorite sayings is when guys say, well, I got someone pregnant when I was 18. I'm like, good for you. Means nothing now. So it's really important for guys to get checked and to be as mindful about their health, what they're ingesting, the supplements they're taking, the amount that they're drinking, stuff like that. Then we have hormones. So we don't have a semen analysis test as women. Like there just isn't one. You can't tell a woman to put her stuff in a cup. I wish that'd be really cool. That was my April Fool's joke one year. No one really thought it was funny. I thought it was hilarious. So until that day, which will be never, we have the AMH test, which stands for anti-Müllerian hormone. I'd love to get into that hormone and what it means. But getting your fertility levels checked shouldn't be scary. It shouldn't be overwhelming. We should think of it as our ability to forecast your fertility. I think of myself as a fertility fortune teller, but I think I'm a little bit better than a fortune teller. But we can use your age, your fertility levels, like your day 3 FSH, estradiol, your AMH, to kind of predict what the future holds for you. You know, there's some 25-year-olds who have a low AMH. Well, that means they'll go into menopause sooner. It doesn't mean that they're going to have bad eggs. It just means that they were born with not as many or they're running out faster. So I think knowledge is power. Finding that stuff out later in life when you could have done something, when you still had more eggs, is always better.
When I was 29 and I found out that my AMH or my ovarian reserve was low, and again, we'll get back into AMH, but I was also told that it doesn't mean I'm going into menopause tomorrow or in 5 years or 10 years, but it does mean I am closer to it, is what you're saying?
Yes, absolutely. So let's say your AMH level is less than 1 when you're under 30. If you think about it, if I were to just make a guess without knowing much more about you, I would say probably your menopause will be 45. That's still normal. You know, it's normal to be in menopause. Like perimenopause starts for most women at 35, a lot of women, and then some women transition by the time they're 40. That's not abnormal. But in current times in our society, 40 is like the new 20. I mean, if you're having a pregnancy at 30 in the Bay Area, and I'm sure it's in New York City, you're like a teenage mom. You're
Totally.
like, you know, it's like, you're 30? Like, seriously, you're going to have a baby that young? So it just kind of, things are just shifting in terms of when we're doing things in life. And so it's like, yeah, you're fertile now, but most women are delaying childbearing, and a lot of women are having their second baby when they're closer to 40. So it just potentially could be a challenge, but it doesn't mean that you can't get pregnant. But if you want to be proactive, doing what you did, preserving your fertility in your 20s is like the best thing that you can do, until I can take one of your skin cells, convert it into an egg, but that day is not here yet. It will come. It will come in your lifetime. Maybe not mine, but I think it would come in yours. So the why is chromosome analysis. So I do that on all my patients as part of my fertility checklist. And then I also do carrier screening to make sure that a couple, or even if you're using a sperm donor, do not carry in common any lethal genes that can cause, you know, deadly diseases in babies. So you don't want to find out in pregnancy. The trend in a lot of OB/GYN clinics is to test patients when they're pregnant. And that's kind of scary and awful to find out that there's like a 25% chance that your baby could have this terrible disease. So we like to do that pre-pregnancy for everyone, even if you aren't having a fertility issue.
So is that when both parties wanting to create an embryo together get separate genetic screening done, and then there's like a cross analysis essentially?
Exactly. Yeah. And even for patients who are not doing IVF, I highly recommend this testing. And for even my egg freezers, I actually do it for them as part of their egg freezing checklist. I would say 9 out of 10 patients think it's valuable, so that when you're ready to use your eggs, even if you're going to get pregnant without using your eggs, you actually have that information ahead of time so you know what to look out for when you're ready to try. So when I started my practice back in the old days, when Netflix wasn't around, we were checking maybe like 50 genes, and then it went to 100. And I was like, wow, 100. Then I went to 2. Now we're at over 800 genes.
Wow.
So things are changing. So I have patients that say things to me like, oh, I already did my genetic screening with you when I froze my eggs. I'm like, that was 2019. Now we're on we're doing a 2025 panel. It's just important to make sure, like, I want to offer patients the latest and greatest of every test that they could potentially do, so we don't miss out on anything important.
And I know in certain, for example, I'm Jewish, and I've heard that if there are two people from a specific religion, sometimes it can cause an issue with the chromosomes as well, right?
Correct. Chromosomes, not as much, but genetic diseases like Tay-Sachs, Canavan disease, Gaucher, familial dysautonomia. There's so many that we want to look out for.
Oh, interesting.
Yeah, fascinating. Would you mind if we jump back to hormones and went into AMH a little bit deeper? Because I feel like that is the 3 letters everyone kind of knows and wants to know more about.
Yeah, so I call AMH always mean hormone. A lot of times it feels pretty mean, or always meandering hormone. And I think there's a lot of misunderstanding about how it changes over time, and it can be really confusing. And the first thing that I'll tell people is that your level does not define you. And one level that's low doesn't mean that your level is going to drop off and you're hanging on an egg cliff and now like menopause is around the corner. It's just not how it works. It very slowly goes down over time until it's 0. It's as simple as that. It stands for anti-Müllerian hormone, which is a hormone secreted by cells that surround our eggs. So the higher the level, the more eggs we have. So someone who has, let's say, PCOS will have a level typically over 3.0. Someone who's perimenopausal, sometimes her level can be below, let's say, 0.6 or something like that. But some women don't have any symptoms of perimenopause until their level's undetectable, which would be less than 0.05. So the level changes, and there are things that you can do that can potentially increase it. So 2 things that are known to suppress it are birth control pills and vitamin D. So women who are on birth control have a 20% suppression of their anti-Müllerian hormone. So if you're getting it checked and you feel like it's low and you're on birth control, you're right. Stop the birth control. I tell patients to stay off of them for 2 months and then repeat. And then vitamin D deficiency can also cause a suppression of AMH. So those are kind of my little quick tips about AMH, how it makes you feel. Know that it can fluctuate and go back up, and know that there are things that you can do to improve it. I recommend CoQ10 and a supplement called OVA NAD. So I believe women who take these 2 supplements long term will have a lower risk of miscarriage in the future if they choose to have a baby when they're over 35. They'll have a delayed menopause. And when they're doing, let's say, egg freezing or IVF, they'll have better quality eggs and embryos. That's my prediction. I'll probably be sending out a survey to you if you're one of my patients in about 15 years to see if I'm right, but I think I'll be right about that.
And so if you had someone who was coming in and they were interested in, say, doing an egg freezing cycle and they weren't on those supplements, do you ever recommend that they take it for a certain period of time before then seeking treatment?
Totally. Easy. 30 days. 30 days seems to be the magic number. I don't think they need to wait 3 months, 4 months. But I think as soon as you're like, I think I might want to freeze my eggs, just get on them. And I think you don't have to take them every day after your egg freezing, but just like cycle on and off, take them most days when you remember. I think it's just something good for your overall egg quality and overall health.
For the fluctuation you were describing with the AMH, can you dive a little bit into that? Because I remember there were certain blood works of mine where it was super low and then we go up a little and down. Are you growing more eggs? What does that mean?
Yeah, well, think about, this is a good one. You can see I work on these analogies. So here we go. So follicles are like waves in the ocean, okay? So some waves are bigger than others, and these waves change cycle to cycle. We have no idea what makes a wave bigger than another wave. No freaking clue. We don't understand follicle dynamics as much as we should, but we know that there are differences cycle to cycle. And so if you think about it, if you have one cycle that has a higher AMH, you can pretty much expect that your follicle count could be higher in that cycle. But we don't know exactly what influences it.
Okay. For that reason, you said before you usually ask people to have their labs tested on day 3. Is that for that reason?
No, not at all. No, AMH is not cycle day dependent. You can get it done any time in the cycle. What is cycle day dependent is your FSH and estradiol level. If you go to ChatGPT, you can just put in like, show me the hormones during a menstrual cycle, and you'll see that FSH is low in the beginning, spikes around ovulation, comes down until the next period starts. And what I see sometimes happen by well-intentioned doctors is they'll just like check a random FSH and an estradiol and then tell the patient she's in menopause. And her FSH will be like 30 and her estrogen level is like 100. And they're like, oh yeah, this is menopause. And I'm like, how about this? You're ovulating. So it's really important to check the levels at the right time. AMH, anytime. FSH, estradiol, by cycle day 4, days 1 through 4 is when you should have those checked.
What are FSH and estradiol?
Yeah, so FSH stands for follicle stimulating hormone. Is basically how loud your brain has to talk to your ovaries to get eggs to grow. So as we run out of eggs, your brain has to talk louder and louder to your ovary to signal follicle growth and development. As the follicles grow, your ovaries will make estrogen. So that's what the estradiol is. So we look at a pattern. So high FSH, low estradiol means one thing. High FSH, high estradiol means another thing. Low FSH, high estradiol means, so we just kind of interpret the pattern, and it kind of tells us what's going on with how good your eggs could be. But it's not a perfect test. So I've had patients, one of my best stories, FSH of 119. Yep, you heard it here, folks.
Is that
On
high
cycle
or
day
low?
3, it's wicked high. So a level
Okay.
over
Okay.
40 equals menopause. She was told by another clinic that she could never have a kid with her own eggs. The donor egg was her only option, and she was able to have a healthy baby with one egg. So that just proves that FSH, again, does not define you. It
Mhm.
just kind of predicts what's going on. And for her, it was, yeah, she was basically menopausal and she only had one egg, but we were able to get her to grow one. But for the most part, if your FSH is over 40, 12 months apart with no periods in between, that's the definition of menopause.
Okay, interesting. One more question on AMH. I know you said something like the oral birth control can suppress it. Can any other forms of birth control, would an IUD affect your AMH level?
Absolutely.
Okay.
Progesterone secreting intrauterine devices can also suppress AMH levels as well. Not as much, but they certainly can.
But however, you can freeze or egg retrieval on an IUD, but not on the birth control pill. Is that
Yeah,
correct?
100%. So the only reason why I would remove an IUD from someone who's going through egg freezing is if they keep making cysts. So what happens with an IUD is sometimes you can have an incomplete ovulation and you make this big functional cyst, and it can interfere with the whole cycle and make it really difficult to start medications. So I would say like 1 out of 100 of my egg freezing patients who has an IUD, I'll remove it. But it's really unusual to need to do that. We use birth control pills as egg freezing planning pills. You take them up until about 5 days before you start your stimulation medications.
Yeah.
Because that syncs your period up with the
It's
medication.
just for
Right?
planning. When I plan my egg freezing cycles for patients, I say like, give me 2 weeks. The 2 weeks where you're going to be the most relaxed, and then make sure that the 2 weeks after you're not, climbing Mount Kilimanjaro. And as long as we're not doing that, let's plan your cycle. And then with enough advance notice, I can literally, like I had a patient the other day say, I want my retrieval on January 9th. I'm like, you got it. Just give me your December period start. I'll get everything lined up with birth control pills because it controls when your ovulation will land.
Yeah. It's amazing that we kind of have the ability to do that. It's
Yes.
Mhm.
fascinating. So we've talked about sort of what fertility is, what we can do to look into our fertility. Can we talk a little bit about lifestyle factors that are actually going to affect our fertility? So what are some of the negative things that we can be doing that are going to maybe poorly affect, both for males and females, our fertility?
Yeah, I mean, I think being overweight, being overall inflamed is bad for infertility for both men and women. So, what's more popular these days is something that I've been adding to my practice for the last few years is the addition of GLP-1s, so medications like Zepbound or tirzepatide, for example. I think eating like garbage is not good for egg or sperm. Smoking cigarettes is very bad for sperm. Smoking marijuana is terrible for sperm and eggs. And smoking cigarettes is also really bad for eggs. If you're let's say 1 pack per day smoker for years, it can make you go into menopause 8 years earlier compared to
Wow.
someone who is
Wow.
not a smoker. Other things that can affect fertility that's out there is just like environmental toxins. So if you're living somewhere that is in a high air polluted area, you want to get a HEPA filter. If your water is not filtered, make sure you're using a good water filter. So plastics in the environment definitely, I think, are contributing to, I think, an accelerated egg loss in women and earlier menopause is what we're going to see, I think, in the future, as well as a decrease in sperm counts in men. Then we have stress. I mean, stress means not sleeping well, depression, anxiety. So I wouldn't say stress causes fertility issues, but I think
Hmm.
stress causes us to have high insulin, high stress, abnormal circadian rhythms that can, in men, decrease testosterone, and women can potentially accelerate egg loss. So those are just the general things that I talk to people about when it comes to the things that they can improve in their overall lives to make their egg and sperm health better.
It's interesting because it's just so many factors that are just a part of people's day to day. And I think when you're young and it comes to your health, you do really take it for granted. And I don't think fertility is always at the forefront of your mind when you're a young person, but you don't realize it's your actions when you're younger that start to affect your ability to maybe procreate when you're a little bit older and you feel ready to do that.
Right. I mean, partying at your sorority, whatever, dance and like drinking too much, that's really not a big deal. But smoking every day, smoking marijuana, not treating your body well, that there could be a cumulative effect that you might regret in the future.
Bouncing off of that, when I was told I had low AMH, they also saw in my scans possible signs of endometriosis. So they put me on an anti-inflammatory diet. So no gluten, no dairy, no alcohol for X amount of time, just to try and like deflame my entire body, including my uterus.
Yep. That's the diet I recommend, is an anti-inflammatory diet, avoiding ultra-processed foods, fresh fruits and vegetables. It's like the best diet you can follow.
Yeah. That kind of leads into like the next question. We've talked about some of the negative things. What are some of the positive things or things that maybe you would recommend for people to do to maybe help improve their fertility outcomes?
Easy. Number one, believe that you will be successful. Address any depression or anxiety that you might have. Get good sleep. Eat healthy, strength train, make sure that your relationship with yourself, that you are emotionally well, and that if you're in a partnered relationship, that relationship is strong. You never want to make a baby with someone that you might not be with 100% 5 years from now. Just trust me, your relationship will not get better once you have a baby. And then move your body, move your legs, make sure you're getting enough steps in. So those are the kinds of things that I talk to people about to improve their chances, in addition to stuff we already talked about, like taking supplements.
I think, obviously IVF or even just going through maybe fertility preservation, maybe if you're just doing a cycle on your own as an egg freezer, it's a super stressful situation. And I think that people kind of take that for granted. And then once they start it and they've got all these hormones in their system and they're feeling more fatigued, it can really burden your life a lot.
Yeah.
So I think your advice is great to try and go into it with as positive a mindset as possible before even starting, because it can be really tough on even some of the most resilient people.
Absolutely. If you go in feeling like you're not deserving, it's never going to happen, it probably isn't. Because you're not going to be taking good care of yourself. You're not going to know how to advocate for yourself during your visits, and you're not going to be a part of your care. But if you go in fired up, excited about what's to come, you'll be nervous. I call it excitus. It's my new phrase of 2025. I feel like that's a better way of thinking about things.
2 more words or acronyms that I want to hone in on, because I feel like they're spoken about a lot, but people don't really know what they mean. Endometriosis and PCOS. I feel like everyone talks about it. Fertility is related. What are both of those?
Yeah, so endometriosis just basically means ectopic implantation of the uterine lining outside the uterus. So it's basically, spring breakers that are not welcome at the beach anymore. It's like they are sometimes there, but usually what happens is after your period, all the cells that you menstruate go away. But in some patients, for a lot of different reasons, it could be an immune dysfunction, genetic. There are a lot of theories as to how it happens. That tissue builds up and it stays around. It becomes sticky. It makes organs stick together, so it can cause the inability of an egg to even get picked up by a fallopian tube. It creates inflammation around the ovaries and eggs and uterus, making eggs lower quality and making implantation less likely. And I think that we're going to learn that in a generation from now, we're going to see so much more endo. And I think it's from plastics, all those plastic water bottles. That's what I think we're going to learn. There's, like I said, a genetic component, but I think that there's a serious, significant environmental component that no one's really talking about enough. As far as PCOS, so PCOS stands for polycystic ovarian syndrome. I think that it's the stupidest name ever. And I can't stand it, because when people, if you were to survey like 5 women and be like, what does PCOS mean? Oh, I have it. I have these big cysts on my ovaries. I have lots of pain. And it's like, no, 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 that's not what it is. It should really be called polytiny cystic ovarian syndrome. Okay. And basically, to have it, you have to have irregular periods, more than 12 follicles on each ovary, signs of high testosterone, and a lot of women have insulin resistance and trouble losing weight. So, and it's not like you have to have all of those things to have it. You know, it's a spectrum, and not every woman who has PCOS is the same. Like you can have a woman who's overweight, has regular periods, a high AMH, and no other issues, but she kind of has some version of PCOS. Then you can have the really, really skinny woman, but she has prediabetes and a really high egg count. So we're kind of programmed to think that PCOS means you have to be on the curvier side, but that's not the case.
Interesting.
And is PCOS also triggered by the plastics and the lifestyle factors?
Yeah, definitely.
Everything.
Yeah, I think so as well. I mean, there's a genetic component, but I also think that our genes can be influenced by the environment. And so I think there's an environmental factor as well.
Yeah, the things that we're going to find out in the next probably not that many years, honestly, from now. And we're just going to go to ourselves. I cannot believe what we've done to the planet and our bodies.
Yep, exactly.
One more question on that topic, and then we can continue. If you have PCOS and if you have X amount of eggs, why does that affect fertility? I got this question a lot because I just had a friend, I think I told you, she had 75 eggs retrieved. And everyone's like, oh, she'll get pregnant so easily. But why might she not having PCOS?
Yeah, because the brain's not telling the egg when it's time to party. And what I mean by that is every month you ovulate an egg. But when you have PCOS, your brain's like, I'm not going to send the signals. So that signaling between the brain and the ovary is not balanced. So it's basically a hormonal imbalance that prevents your egg from ovulating. So you have a 28-day cycle. So maybe it happens every 40 to 50 days that your brain sends the signal. Maybe it's once a year. Maybe it's never. So there, some people have more severe PCOS where they don't ever get a period. And for some people, it's a little milder, so they get a period every 35 to 40 days. So that's basically the reason. It's just that signaling pattern between the brain and the ovary. You don't have those nice patterns. It's kind of blunted where your LH level is always high rather than pulsing the way it should.
So at this point, we've kind of discussed like what is fertility? How do we find out about it? What would you say, so someone's coming to see you, what are the fertility treatment options that people have available in this day and age if they came in to see a fertility doctor?
Yeah. So the first thing, not your question, is like, are there things that you go to a fertility doctor for that don't involve treatment? And so sometimes you go to the fertility doctor and we say like, everything's fine. Maybe just supplement with progesterone, for example. So just going to the fertility doctor doesn't mean, and you have to do treatment. But I think it's a good question because everyone should know what is on your menu. So I'm like a waitress at a restaurant and I'm like, how would you like to take your eggs? And I give everyone their options and I describe to them first what their diagnosis is, what their prognosis is, and then what the treatment options are and what the chances are based on their diagnosis and prognosis so that they never feel like no one ever told them or it wasn't explained enough or I have unexplained infertility. So the first option is to just augment ovulation. So even though women sometimes ovulate and we give them fertility pills, it doesn't mean that they're not ovulating. We're just trying to augment their natural ovulation. It's called ovulation induction, but I like the word augmentation because most women who are on these medications are already ovulatory. By taking fertility pills, you're helping a woman potentially ovulating more than one egg. So it's kind of a twofer. I wish we were like, I can't remember what, I know there are animals out there that like they ovulate every day. Like that'd be pretty awesome rather than what we do. It's like, wait for it, ovulate, wait for it, period. So by taking the fertility pills, it's like, wait for it. 2 ovulations, so 2 chances in one cycle, and then wait for it. So it doesn't mean that everyone gets pregnant with twins. Human beings are extremely inefficient when it comes to having a baby. So it just means like maybe an 8 to 10% chance of twins. If it happens to you, it's 100%, but it's not like everyone who takes these medications is running around with twins. With that treatment, you can do the turkey baster approach, which is basically not a turkey baster. It's a tiny little catheter that we place at the top of the uterus for insemination, where we put the sperm there. A lot of people think that IUI is this like magical thing. It's like amazing, it's going to work. And I'm like, no, it's just putting the uterus at the top of the uterus, and maybe you have like a 5% higher chance of pregnancy with that. So I think it's really important if you're choosing a treatment is to know the real deal, like what really are your chances, like, and how much is it really improving things. So I think IUI is great for people who fight around ovulation. And a lot of people do, or you don't have time and it's like you're busy and it's just such a headache and you don't even want to think about it. So I'm like, stop fighting, take it out of the bedroom, come to my office. And then as far as sperm, sometimes sperm is just a little bit on the lower side. So maybe IUI will help. But if sperm's really poor quality, IUI will not help. So a lot of people I see sometimes do IUI thinking it's going to help really bad sperm, and it will not, because really bad sperm is still putting really bad sperm at the top of the uterus, and it's not going to be able to do what it needs to do. And then with IVF, you have the option to transfer day 3, freeze day 3, freeze day 5, 6, or 7 with or without genetic testing, transfer day 5. So many things you can do. And then certainly I also help patients with egg donation, sperm donation, surrogacy. So these are all the kinds of things that we can do. And one day I'm going to be like, and in vitro gametogenesis, but not yet. One day.
You're right. It's like a menu. It truly is. And I think that's where it can feel overwhelming to people. But I think it's about having those conversations with these professionals. So going in to see a doctor and talk through the menu with them and figure out what serves a specific person, an individual, a couple, because it's a lot. There's a lot of options. And I think trying to find the formula that fits you can feel really overwhelming. And I think just going and talking to a doctor can really help you figure those things out for yourself and your circumstances.
I think it's also important to know what you want and to go in ready to explain that. Because I think a lot of people make assumptions. Like if you're, let's say, a single woman at 37, not everyone's going to think that you might want to have 2 kids, right? I'm going to ask you, I'm going to say like, how many kids do you want? And they're like, oh, wow, I didn't think that I could. I'm like, well, actually, you potentially can. Let's talk about preserving your fertility. So I think knowing what you want and expressing that is really important.
Yeah, absolutely. It's funny, when I went to my first fertility consultation with my husband, for some reason it didn't occur to us to have that conversation before we're sitting there in front of the doctor. And he goes, how many kids do you want? And it was like he'd asked us the most invasive question in the world. And then I was like, where are we right now? We should really know the answer to this. So that is a good, I think, tip to listeners is know what you want and then see your fertility doctor.
Yeah. So not only know how many kids, but what would you both be willing to do to get there? Like for some, I think it's just, even though most people are like, oh yeah, we're going to try naturally to have a baby when you first meet, but sometimes it takes more creative family building. So just knowing what each person is open to, and sometimes that shifts, I think can be also helpful too, as part of the conversations you have early on in your family building.
Yeah.
Totally.
There's some good tips, I think, to have before you go in.
Yeah.
Know what you want and know what you're willing to do to get there.
Where can people find your show, your podcast, the TUSHY method, your social medias, and how can people get a consultation with you?
Oh, you're so sweet. Well, consultation's easy at my website, draimee.org. And then anywhere you can put Egg Whisper, you'll find me. So I also have Egg Whisper School. So for patients who don't want to, let's say, see me directly and have me guide their care, you can go to eggwhisperschool.com and sign up for one of my IVF classes that I do each month. It's just basically a live class where I do a scientific presentation followed by live Q&A. And I don't get off the Q&A until every person's question is answered. I also have my medical license in all 50 states. So no matter where you live, I can provide my medical opinion and help you as a fertility consultant on your journey, or directly have you come here for your egg freezing or IVF treatment, whatever it is that we end up doing.
Oh,
You're amazing.
you are amazing, Dr. Aimee. We really, really appreciate you. I love the way you have an analogy for everything. I think breaking things down is the best way to help people understand. And I love that you can do that with anything we bring at you.
Yeah, thank you. I work on them. I literally think of them in my sleep. Lately, I've been like doing this dance, and my husband's like, "What are you doing?" And I'm like, "I'm coming up with my newest thing." And he's like, "Stop doing that. You look so weird." I'm like, "Believe, depression, anxiety, sleep." make sure you're eating healthy, lift your weights, make
Oh
sure
my-
your emotional health is good, kiss your ovaries, move your legs. And he's like, you're so weird. I'm like, I know, I can't help it.
It makes sense.
It
makes
really
sense.
does. And I think it makes it feel less daunting to people because everything feels so scientific. And when you're trying to make sense of all of that, it's really overwhelming. So when you can just break it down into just the perfect analogy or dance or acronym, it's amazing. So we're named Scrambled, as you're aware, Dr. Aimee. So we would like to know what has got you scrambled in life right now.
Trying to figure out how to shuffle dance.
Oh,
Okay.
Yes. So I could do a demonstration for you, but I would be embarrassing myself. So I'm not going to. But shuffle dancing, you watch these videos and you're like, that looks so fun. So I've been trying it alone, not to embarrass myself. So like I'll put a video on and then it takes me about like an hour because some of them are really, really hard.
Wow.
And then I sent them to my sister and she's like, you need a new bra. And I was like, that's not a bra. That's my sports bra.
I have to ask though, where has that come from? What did something fall into your algorithm recently that showed you a shuffle video?
Yeah, so I love EDM music. I'm slightly obsessed. So Diplo's my boyfriend. He just doesn't know it yet. But yeah, so I go to EDM concerts, anytime there's one in the Bay Area, like a lot of the big names I've gone to and I love seeing them. And so shuffle dancing is something that you do to EDM. So I get a lot of EDM stuff in my, in my algorithm. So it keeps popping up. I'm like, oh, I have to learn how to do it finally.
I feel like there's nothing you can't do. So I
I
have
know.
full faith that you can become a shuffler.
I will try. Maybe we'll see. My office holiday party is coming up soon. And so there's a shuffle dance instructor that I was going to hire to come and like teach us all like a short little dance. And I thought that would be super cute and fun, probably more for me than anyone else, but it's an idea that I have.
I love it. I would love that to happen at my
Spice
holiday
it up.
party.
Yeah, spice it up. Why
Yeah.
not?
Thank you, Dr. Aimee. This
Thank
has
you
been
so much.
amazing.
So informative, truly.
Well, thank you for having me. Such a pleasure and so fun talking to you. I hope your audience members really hopefully took something away from this.
I'm sure they would have. We really, really appreciate you taking the time to chat with us. Thank you.
Thank you.
You're welcome. Thanks.